Backgroundnya orang sing gawe piye dikarepe iki? Oh, orang sing gawe background. Dengar. Coba backgroundnya yang Zoom meeting dipakai. Wes mulai, Pak. Bisa bisa tak ngomong dokter Lorica. Good morning, Dokter Josephine. Kita panggil dulu Dokter Josephine ya.
Assalamualaikum warahmatullahi wabarakatuh.
Sebentar, sebentar, sebentar Mbak Mas. Mbak siapa ini? Sebentar ya. Jangan buka dulu. Kita tunggu sampai Dokter Lorica masuk. Ini tadi masih download background. Good morning, Dokter Lorica. Because Dokter Lorica cannot be download about our background, I think no problem.
I'm
Yes,
trying to
I will.
link the
Yes.
device.
Okay. Maybe you can show your Buki. Nah, satu. Bentar ya.
It's okay. I am able to get into the computer already. I'll just.
Gitu. Ya, aku tahu. Mana mimiti ngomong nih kata apa sih. Thank you, Dr. Lorica. Please, we can start.
Assalamualaikum warahmatullahi wabarakatuh. Salam Om Swastiastu, Namo Buddhaya, Salam Kebajikan, Rahayu, Rahayu, Rahayu. The Honorable Head of Diplomatry Blitar Nursing Study Program, State Health Polytechnic of Malang, Wiwin Martiningsih, MK PRCNS, whom we respect our speaker this morning, Dr. Josephine Lorica, RN DPA, whom we respect lecturers and fellow academia of Diplomatry Blitar Nursing Study Program, whom we respect the participant from Trenggalek Nursing Study Program, Ponorogo Nursing Study Program, Malang Nursing Study Program, and all my loving audience. First of all, let us praise to the Almighty Allah Subhanahu wa Ta'ala. Because of His blessing, we are able to come here to join guest lecture of Blitar Nursing Diplomatry Nursing Study Program. Secondly, may peace be upon our Prophet Muhammad Sallallahu Alaihi Wasallam, who has guided us into the right ways of life. Ladies and gentlemen, my name is Amelia Rizky Prayoga as the Master of Ceremony today on 5th November 2024 at guest lecture of Blitar Nursing Diplomatry Study Program with the title Nursing Informatics. We would like to extend a very warm welcome to all of you. We appreciate and thank to all of you taking time off your schedules to join this program to level up our knowledge about nursing informatics. We hope this program will give an advantage for us in the future. Well, in this special morning, we have several agenda. So, I as Master of Ceremony today, I would like to outline all the agenda are as follows. The first agenda is opening. The second is listening national anthem Indonesia Raya and Polkes Mahim. The third is combined report of this program by Fahriza Nur Aziza. The fourth is welcome speech delivered by Wiwin Martiningsih, MKP at CNS. The fifth is speaker resume reading, continue with a material delivered by our speaker, Mrs. Josephine Lorica, RNTPA. The sixth is handover of certificate to presenter at today's international guest lecture. The seventh is prayer. The last agenda are documentation, continue with closing. Well, to take the advantage of the quality time, let us open this program with basmalah together. Bismillahirrahmanirrahim. Ladies and gentlemen, now let us listen the national anthem Indonesia Raya and Polkes Mahim. So, for the audience, please stand up.
nilai kemanusiaan, berbudi luhur, berakhlak dan berbudaya. Kami Poltekkes Kemenkes Indonesia berjanji pada bangsa dan negara, bekerja profesional, berprestasi, melangkah bersama mandiri mendunia. Kami Poltekkes Kemenkes Indonesia berjanji pada bangsa dan negara, penuhi panggilan untuk mengabdi, berjuang dengan segenap jiwa raga, berjuang dengan segenap jiwa raga.
For the audience, please take your seat. The next agenda is Combined Report by Fahriza Nur Aziza. So Fahriza, time is yours. Assalamualaikum warahmatullahi wabarakatuh. Greetings to all of us. Honorable on the head of the Diplomatry Bitar Nursing Study Program, Mrs. Wiwin Martinisi, MKPSDNS. Honorable Dr. Josephine Lorica, RNDPA, as the speaker of the International Quiz Lecture today. Honorable Ms. Irka Maharani, MD Cup, as the moderator of the International Quiz Lecture today. Honorable the lecturer and academician of the Diplomatry Nursing Study Program, and as well as all happy webinar participant students. First of all, let us express our gratitude to the Almighty God who has given us thousands of blessings today, so that we can gather at the International Quiz Lecture with the theme is Nursing Informatics on Tuesday, 5th November 2004. Ladies and gentlemen, I am Fariza Nur Azizah as the Chief Executive of the International Quiz Lecture would like to thank the audience who have taken the time to attend today and friends who have enlivened this event. I would also like to thank all the committee and colleagues who have helped in organizing this event. The objective of this international quiz lecture are: first, in order to support the documentation and methodology nursing, and secondly, implementing the work program of HMP Diplomatic Nursing Blitar. This event was attended by Blitar Nursing Diplomatic Study Program Nursing. Dear ladies and gentlemen, let's follow this event well so that it can run smoothly and we can reap the benefits. Finally, if there are any shortcomings in organizing this event, I apologize. Congratulations on attending this event and hopefully it will be useful. Wassalamualaikum warahmatullahi wabarakatuh. Thank you for the report. Before we start our main agenda, it is with great pleasure that we have to deliver an opening speech by the head of our study program, Wiwin Martiningsih, MKPSDNS. Time is yours.
Okay, thank you very much, the moderator. Good morning, everybody. Assalamualaikum warahmatullahi wabarakatuh. Dr. Lorita, I am so sorry because the camera, actually there are 200 students attend in this class, but because the camera is, battery is low, so the camera cannot. Maybe we will wait first. Again, the Honorable Dr. Lorica as the speaker of today's international guest lecture from St. Paul University, Philippines. Thank you, Dr. Lorica. all of lecturers, education staff, and all of students. Praise be to Allah Subhanahu wa Ta'ala because we are all in good health and keep spirit. The theme of this international guest lecture is Nursing Informatics, Support for Quality Nursing Care. This is the theme from Dr. Lorica. And the topic, I think, does not only support one or two of our subjects, but with the rapid development of technology, it is hoped that we are ready to implement it in providing quality nursing care. Because patient satisfaction is also nurse satisfaction. Hopefully, the activity will run well and we will get many benefits. Once again, thank you in advance to Dr. Lorica, who has attended in this activity. I think that's all from me. Wassalamualaikum warahmatullahi wabarakatuh. Good morning.
Thank you, Ma'am Vivin, for your speech. Ladies and gentlemen, the next agenda is the reading of the speaker's resume, followed by our main agenda, namely the international guest lecture held by the Diplomatry Blitar Nursing Study Program, with the title Nursing Informatics, presented by Ms. Dr. Josephine Lorica, RN TPA. For this agenda, I hope that the audience will pay attention from the beginning of the material to the end. And this session was moderated by Ms. Irka Maharani as moderator. I invite you to take over this session.
Check. Well, thank you very much, Amelia, as the master of ceremony. Hello, everyone. I'm Irka Maharani as the moderator of this international guest lecture with the theme Nursing Informatics. For your information, this guest lecture is to support the subject of documentations and methodology of nursing. Well, I'm sure all the audience here are very curious about this and cannot wait to know more about nursing informatics. Today, we have an expert who will talk about it, and please welcome Ma'am Dr. Josephine Lorica. How are you going, ma'am, today?
I'm okay.
Yes, ma'am. Well, before we jump to the main agenda, I'm going to read the curriculum vitae of the speaker briefly. Okay, our speaker today is Ma'am Dr. Josephine Lorica, and I will read the educational background. She was graduated from Bachelor of Science in Nursing in 1991, and then graduated from Master of Science in Nursing in 1995, and then Doctor of Public Administration, St. Paul University, Philippines in March 2004, and currently studying Doctor of Philosophy in Nursing Science in St. Paul University, Philippines. And then Ma'am Lorica also got a scholarship grants from tertiary education, selected ethnic group educational attainment program, St. Paul University, and the faculty also get the research practicum on populations and health social development and research center, De La Salle University in 1995. And from the work experience, Ma'am Lorica also has dedicated herself in St. Paul University more than 30 years. Yes, ma'am. In St. Paul University, and currently she is the faculty in St. Paul University from 1992 to now. Also, the other positions, I will read briefly. Right now, Ma'am Lorica is also the chairperson of research committees and then chairperson multi-sectoral group council, and then member structure operational monitoring evaluations, and also member of technical review board, and also member of research ethnic committee in 2018 and up to 2020. And also the membership in organizations, Council of Deans, Health Science Cluster Region 2 as the Vice President, and also Maternal and Child Nurses in Philippines, and Philippine Nursing Associations, Gerontology Nurses Association of Philippines, and also Ma'am Lorica also have many skills like research mentoring, publications, review and editing, use of computer, encoding, Excel training, facilitator, documenter, community organization, writing project proposal, research, online module development, use of Moodle as learning management system, reviewer or lecturer for psychiatric nursing and nursing research gerontology. Well, everyone, for your information, that's all the briefly curriculum vitae of the speaker this morning. Well, dear all the participants, we have an hour and a half in delivering the material of the speakers and a half an hour or 30 minutes for the Q&A sessions. For all the audience who want to ask directly, just click the raise hand button and you can drop your questions in the chat box, and I will read your questions while the Q&A sessions. Well, ladies and gentlemen, due to the limited time, let's move to the main agenda, delivering the material for Ma'am Dr. Josephine Lorica. Please, ma'am, time is yours.
Thank you so much for the very kind introduction. Let me just share my screen. Okay, so thank you. First and foremost, I would like to thank Dr. Wiwin for inviting me as your speaker for today. As we talk about certain things now with regards to the topic that I would have to tackle, currently I'm teaching in the level 3 and I'm teaching nursing informatics. I'm the only faculty for the lecture because currently I am the only one trained. So when Dr. Wiwin asked me, I said, I think I would better teach nursing, share about nursing informatics. So I've chosen the title Nursing Informatics as a support for quality nursing care because today I would like us to appreciate how important it is that we nurses would have to be educated in relation to nursing informatics. To start with, let me introduce my university. So this is St. Paul University. It is almost 8 hectares across. So we're also the biggest school, St. Paul School in the Philippines, because we are offering from preschool to graduate school and even postgraduate. Okay, so I hope that one day you'd be able to visit the university. And we're also proud to say that over the years, ever since 1992, when I started in St. Paul University, we have been consistently a center of excellence for nursing education. Okay, so we're also currently working again for the reaccreditation of the level 3 and level 4 of the Philippine Association for accreditation. Okay, so this is the university. You see the beautiful chapel that we have, and of course, one of the newest building that we have where we have I Love SPU. Let me further introduce myself. Okay, I have graduated way back in 1991. Okay, so I've been working as a nurse, but I only took my license in 1992. Okay, why? Because I graduated as a nurse and passed the board exam with 20 years old. And in the Philippines, you cannot get your license until you're 21 years old. So I have to wait for a year for me to be able to get it. And then I've been in the university for the past 32 years. When I started taking my master's, there was an offer for me to teach in St. Paul University. I started teaching psychiatric nursing, but now for the past, I think, 15 years, nursing research. And for the past 5 years, I've been teaching nursing informatics because I was one of those who trained, for teaching nursing informatics in the Philippines. So for the objectives of this particular presentation, so I would like that at the end of the presentation, we would be able to define in nursing informatics, provide a rationale for the need for informatics, specify nursing informatics competencies, and discuss the factors that affect nursing informatics. So we start off with defining what is nursing informatics. Okay, so the American Nurses Association, as you all know, the educational system of the Philippines is always aligned with that of the United States. And that's why when you now look on in terms of how students are taught, in terms of the Philippines, we are always aligned with the curriculum of the United States. And majority of our references are also coming from the United States. Okay, so nursing informatics here is assigned as defined by American Nurses Association in 2019, and the Health Information Management System in 2019 is that it is a specialty that integrates nursing science with the multiple information and analytical science to identify, define, manage, and communicate data, information, knowledge, and wisdom in nursing practice. The specific definition is actually very broad, okay? But looking on in terms of this particular definition, we have to understand that the first and foremost is that we need to know what is nursing science. And when we talk about nursing science, we're always talking about a primary role of the nurse, which is to promote health, prevent illness. Of course, there will be an intervention of curative and curative as well as rehabilitative. But one of those in terms of nursing science is that we should not be able to put aside the caring function of the nurse. Caring is no longer just found in terms of the nursing, but this caring has also now extended towards this particular other health sciences. But one of the most important thing that we need to understand as we now do caring and look on in terms of the essence of nursing is that we always try to collect data. And when we collect data, we organize them, then coming up with analysis so that we would be able to come up with certain conclusions regarding what things would we have to do or what can we implement in terms of our patient care. And that's why the basic of nursing science is a first and foremost necessity for us to be able to understand nursing informatics. Because with nursing informatics, we have to go again in terms of understanding certain concepts coming from computer science, coming from information science, and also concepts coming from cognitive science. And this encompasses something that we need to delineate, first and foremost, nursing, so that we would be able to integrate this particular concept. And when we say identify, define, manage, and communicate data, this is also not new to us as nurses, because this is what we do. We usually collect, and we need to identify which data would we need to collect for us to be able to understand things and for us to be able to analyze and come up with certain conclusions. But what is important is that in terms of nursing informatics, one of the things that I would like to focus on is that we need to define, okay? Define the data or define the concept that we need to understand. Why? Because again, when you talk about informatics and we're talking about it in terms of putting in the context of technology, particularly the use of ICT in nursing, we need to have a standardized definition of this particular data so that everyone else would be able to understand. And then, of course, we would be able to manage it and then, of course, communicate it. The framework of nursing informatics primarily talks about data, information, knowledge, and wisdom. And data, okay, is actually the very raw information that we have. And then when you start saying it becomes an information, you are able to group it and put it in the context of, grouping together Then when you talk about knowledge, you start trying to say an application of what this data is. Okay, and then wisdom would now be providing an action, okay, towards this particular thing. Again, no, I spend usually at least 2 hours, no, for the discussion of the DIKW as a framework for nursing informatics. But for now, I think, no, you just have to contextualize it in terms of the definition of nursing informatics. So understanding why do we need to learn about nursing informatics. This is actually a framework by Parker and Troy, and it's one of the particular framework, no, that I've seen, so that we become clear in terms of where are we in terms of nursing informatics. So you see from the left part, no, you see the clinician and advanced nursing practice. And then from the right part, you see the informatics nurse and informatics nurse specialist. So where will you find yourself here? Okay, you will be in the entry level in terms of your course. Okay, I think you are level 3, if I'm not mistaken. No, so you're third year. So this one, diploma, ADN, ASN, BSN, second degree BSN, and pre-licensure masters are all found in the entry level. And in terms of the entry level, the particular competencies that you need to have is information literacy, information management competencies, and of course the basic, no, would be the baseline that we need to have. Okay, we'll be able to understand it more as we go further in terms of this lecture. When you're at the master's level, you need to analyze healthcare information and communication technology strategies to be able to reduce risk, improve care, delivery, change policy, while providing oversight and guidance in the integration of technology in practice. So here, you now go to a higher level and you now become a master's level. Okay, and of course, when you go to the doctorate level, you need to lead the design, selection, and evaluation of healthcare ICT systems that promote effective and ethical use of patient information, and you use informatics in research and report writing. Okay, but when I teach nursing informatics, I usually have students a taste of each of the level so that they would be able to appreciate what nursing informatics is. Why? Because again, not everyone else, when you go to the area, would would be allowed to do or to handle the systems that are in the hospitals. But clearly, one of the most important things that you're going to have to look into is that understanding your basic computer competencies would actually lead you to your information literacy competencies and information management competencies for you to be able to practice as a informatics nurse. So looking on again in terms of why the trend towards NI? So according to Australian Digital Health Agency, the trend regarding information communication technologies is increasingly present in our profession due to changing and advancing technology. And this is to increase efficiencies, improve workflows, and promote safety and quality care delivery. That's why we need to understand that we cannot veer away or we cannot say no in terms of the trend, particularly for nursing informatics. Because if not, we will be left behind. Or if not, we will not be hired by very good hospitals because we don't know how to handle the technology that they have in this particular area. Okay, so we need to be updated in terms of, or we need to align ourselves in terms of the use of nursing informatics so that we would become more efficient. Okay, because we say that computerization and automation would actually lessen the work of the nurse in terms of documentation and provide more time for the nurse to be able to deliver or do nurse-patient interaction. It would also improve workflows. Why? Because there are certain things that automation would actually do, and therefore computers could actually some guidance in terms of coming up with certain appropriate actions. Okay, so they can facilitate decision making for us so that we would be able to identify specific interventions that are more appropriate in terms of patient care. And of course, that would now more or less promote safety and quality care delivery in terms of our patient. Another reason why we need to come up with nursing informatics is that Healthcare systems are integrating technology daily at a very fast pace with considerable benefits, including storage, management of vast amounts of data, coordinated patient care, improved access and quality of patient data, and improved interdisciplinary communication. So one of the things that nursing informatics or informatics in general brings about in terms of healthcare is that it integrates what is in the primary, secondary, tertiary. Okay, not only that, but it also integrates care across all healthcare disciplines. Okay, and that's why when you start telling things, no, or you don't need to refer things if and when there is nursing informatics because the technology would actually do that for you. Okay, you don't need to send information because the doctor, if and when he or she is online and has that particular application, can already open the information about the patient. And this way, the intervention, okay, and coordination among healthcare professionals would be faster and easier. Okay, and this is something else that would help us out in terms of providing better patient care to our client. Okay, or if not quality patient care to our client. Okay, and this is according to McCabe and Timmins 2016, Rislin 2017. Okay, another rationale for nursing informatics and joining the trend for nursing informatics is that security and patient privacy must be upheld while achieving the goal of transforming data into useful knowledge. One of the things that we have now as a challenge is that with the incoming ICT development is that there is also more threat, okay? Data breach, okay, virus, putting on in terms of hacking, okay, becomes a problem. So every time we put data into a computer, there is an associated problem in relation to it. And if we would like to put on data and process them through the computer, we need to also understand that nursing informatics should make us aware in terms of what are the security threats and threats regarding patient privacy. We all know that when understanding health data is actually protected information. Okay, why? Because it can actually be used against a person. And that's why when we now talk about the trend of nursing informatics, security and patient privacy is actually one of the concerns that we need to look into. We cannot use the free software when we're using nursing informatics and utilizing it in terms of our technology. Okay, why? Because we have to protect patient information. Confidentiality and privacy goes along, but we need to add security as part of it. Why? Because they could actually take on certain information for us from the system, okay, and actually utilize it. Or they could actually disable the whole system in terms of your healthcare because of certain viruses that they could actually provide you, okay, or bring into the system so that there will be a software failure. So we have to become aware in terms of all of this so that we would be able to know. And this could actually be facilitated when we now move on in terms of understanding what nursing informatics is or can do in terms of our healthcare. Likewise, when we talk about nursing informatics, the thing that we need to understand is that we don't do the coding. We don't do the coding. But what is important is that nursing informatics, when we try to involve ourselves with nursing informatics, we should be able to support nurses, support patients, support consumers, support other interprofessional healthcare teams and other stakeholders. Okay, support in terms of what? Coming up with appropriate decisions regarding the healthcare that they need to achieve. Okay, and that's why when you now talk about nursing informatics, you're not only talking about supporting nurses, but all others. Okay, it becomes a mini system in itself where it has certain subsystems. And this would also tell us that the general systems theory could also be one of the framework that we would need to understand if and when we're working on in terms of nursing informatics. You might be asking, who are the other stakeholders? Okay, who are the other stakeholders? When we're trying to develop systems, okay, particularly the hospital, or the institution could actually get, or actually identify certain organization or institutions who could provide the service for them. Okay, and they could actually be part of the other stakeholders or any other member of the society or organizations outside the healthcare, which could help us out in terms of supporting, the role of nurses, patients, and consumers, and other interprofessional healthcare teams in terms of providing quality care for our clients. So this is a necessary, and that's why I would say that nursing informatics is a necessary thing that we need to learn as part of our skill and competency, particularly you as graduates, of the 21st century. So we need to understand nursing informatics competencies. Why do we need to look on in terms of or understand what is it that we need to look on in terms of nursing informatics competencies? As I've said a while back, the growing digitalization of healthcare helps us now to be able to provide appropriate care, okay, or if not quality care for our clients. It would provide us a more time for nurse-patient interaction or face-to-face interaction with our clients. Therefore, certain things, particularly those that I call knowledge that could actually be transformed into informatics or could actually be automated, could now be provided so that there would be more care to your clients. And how would we be able to do that? We would have to be competent in terms of your nursing informatics skills. Okay, so informatics competencies could actually lead graduates, okay, to be prepared for the technology-enabled work environment. We cannot say that we don't like to be working with technology. Why? Because everywhere you go, technology is there. And I think everyone else now has also a smartphone, which we could actually utilize for patient care. Okay. Yes, it could actually be a personal thing, but you could actually utilize it in terms of your patient care as part of your nursing informatics competency. Only that you're going to have to go to a higher level. Okay. So let's understand the nursing informatics competencies. So there are a number of things that we have to identify in terms of nursing informatics, and across, there are certain things that has been included. So nurse informatics competencies, according to McGonigal, Hunter, Sipes et al. In 2014, includes abilities to use information communications technology, data and information management skills effectively and appropriately in the technology-enabled work environment to improve patient care and health outcomes. We as nurses have never been more concerned about improvement of patient care. But one of the most important things that we need to understand now is that we need to be concerned not only about improved patient care, but we need to be concerned about health outcomes. Okay? Slowly, we were able to realize this as we now move on towards a lot of things that we need to understand. And therefore, as nurses, one of the things that you would always have to think about is health outcomes. What would be the outcome of the care that you would like to have in terms of your patient? Okay, so here in nursing, when considering your nursing informatics competency, being competent in nursing informatics could actually lead you, in terms of coming up with concrete health outcomes. Okay, so moving further in terms of nursing informatics competencies, there are a lot of tools that would talk about certain nursing informatics competencies. But I was able to find Canadian nursing informatics competency assessment scale, which now simplifies and I think would put the context of the competency in a particular context of the ASEAN. Okay, ASEAN, particularly the Philippines and Indonesia. Okay, so that's why I made use of the Canadian NICAS by Clabe and Nago of 2018. Okay, you can find the tool there. Okay, you can actually identify how competent are you in terms of the certain items. Okay, so for the first part or first component of the nursing competency would be your foundational ICT skills. And when you talk about foundational ICT skills, you need to be able to utilize or use your ICT devices. Okay, So what are your information communication technology devices? These are your computers, your laptops, your web, your internet, okay? I think basically these are the things that you need to look into. And when you talk about devices, this talks about your physical devices that you have, okay? So do you know what where would you be able to look on in terms of your connection? Okay, so what would it be? No? So server, where is your server? How would you know your access in terms of this? Okay, when you're looking at your cell phone, what is it that you're utilizing? Is it the Wi-Fi? Okay, when you're using at your computer, what is it that you're utilizing? Would it be a Wi-Fi or a line connection? Okay, so do you know how to make use of this? And I think these are the things that you need to understand for a foundational ICT skills. And that's why one of the courses that we have in terms of the nursing curriculum would be the basic, no? Or when you say we have your ICT in the 21st century. You need to understand that for us to be able to move on and come up with a course called nursing informatics. Second would be the use of ICT applications. So when we talk about applications, we're talking about softwares, okay? The systems that are there, supposedly, that would help us come up with a more appropriate thing regarding our searches, okay? So the devices and the applications actually make up what we call your computer science, the understanding of what is in terms of computer science. And that's why the basic concepts of ICT in the 21st century would have to be part of the courses that you need to take or a requirement before you can actually take on nursing informatics as a course. Okay. Then the third foundational ICT skill would be perform search and critical appraisal of online literature and sources. This could actually well become part of your information management. But I think basically when you talk about foundational ICT skills, is that we need to be able to perform search. I think you can do that. But one of the challenges that I have seen in terms of students are actually critically appraising online literature and sources. Okay. When I ask my students to do this is the basic, one of the things that I would actually ask them when I start off in terms of nursing informatics laboratory. I ask them to search for the definition and examples of nursing informatics system, nursing information systems in the web, okay? And I ask them to critically appraise, okay, or evaluate the sources of the literature that they are trying to look into. Again, you could actually be assisted in terms of your searches by knowing how to manipulate your web searches, okay? Your what do you call that? Google, okay? Your computer. When you now look on in terms of what will you be using? Will you be using Bing, Yahoo, or Google? Okay, and as you go through that, there has to be certain skills in terms of how would you utilize your computer to be able to assist you in terms of making your searches more attuned, in terms of what is it that you're trying to look into. You can organize your searches or the web pages according to its relevance. You can lessen other web pages by providing certain things that you need to put on, okay? Like your close and open quotation to be able to limit certain things in terms of your searches. And these are the things that you can actually use as part of your foundational ICT skills. Of course, the critical thinking of the student trying to identify or asking themselves, is this website really reliable, would also be one of the things that you're gonna have to look into, okay? And this is part of your foundational ICT skills. We're moving on to the second component, which is now information and knowledge management, okay? For information and knowledge management, part of the competency would be to analyze, interpret, document pertinent nursing and patient data using standardized nursing and other clinical terminologies. I've told you a while back that defining the terms is very important. Why? Because this now becomes your explicit knowledge. Explicit knowledge are the knowledge that we can actually automate and we can organize, okay? Because when you now come up with certain terminologies, you have to be concerned about this because everyone would be utilizing supposedly this particular terminologies. And therefore, each one would be able to understand what this means. Okay? From the patient data, for example, when we're talking about your BMI, okay? When you talk about your BMI, what data do you need? Okay, so when you talk about it, you need your data, which is now your weight, your height, your age, and your gender. And sometimes you can also talk about your nationality. Okay, so when we talk about age, it's easy to say age, but what is it? You need to contextualize your age in relation to the information that you would like to know, like your BMI. So which means that you need data for age in years. Okay, what about weight? Okay, so when you now talk about weight and you're now working on in terms of your data for BMI, you need to work on in terms of your weight in kilograms. And then here comes now the most challenging, height. When you talk about height, the common measurement of our height is actually in centimeters and in feet and inches. Okay, but when you start defining and are trying to understand supposedly your height, and you're actually connecting it in terms of your BMI, you have to define your height in meters. Okay, in meters. So this now tells us that when you now start analyzing, interpreting, and documenting pertinent nursing and patient data, there has to be a standardized nursing and other clinical terminologies, which means that just like in research, when you're thinking about certain variables, you have to define it operationally, depending on how or what particular information you're actually trying to get. This is important because when you start working with an information technologies and coming up with a system, you need to understand this as, you need to communicate this particular information clearly to the information technologies so that it will become part of the system. Second skill, second competency for information knowledge management would be assisting patient and their families to access, review, evaluate health information. Okay, so when we assist patients and their families to access, review, and evaluate health information, okay, this is partly, again, your skill, okay, but of course, you also would have to first and foremost need to know how to access, review, and evaluate health information. Now, with the technology that we have, everyone has a cell phone, okay? But the question would be, how will you now teach or assist your patient and their families to access health information? Okay, of course, health information that should also be valid and reliable. Okay, which means now that you have to go back to your foundational ICT skills. Okay, and if you're able to do that, supposedly you can already assist your patients and their families in terms of this particular competency. Third, describes the process of data gathering, recording, and retrieval, okay, in electronic or paper records, and identifies informational risk gaps and inconsistencies across healthcare system. Okay, this is what we say in terms of your workflow. Okay, you need to describe the process of data gathering, recording, and retrieval. Why? Because this would have to be coded or put into the system. And who would be able to understand more what particular processes are we going through if not the nurses? Okay, take note, we are not the one trying to develop the system. We are working, we are the bridge between the nurse in the area, okay, and the information technologist. And therefore, we should be able to describe the process of data gathering, recording, and retrieval so that we would be able to assist the IT in terms of understanding what are the nurses doing, okay? And take note, when you now talk about the workflow is very important in terms of, developing the algorithm, in terms of the systems that would have to be developed, okay? Fourth would be articulates the significance of information standards. Again, when we talk about articulating the significance of information standards, we need to know what are the bases, okay? Basic. So the knowledge background in terms of certain information that are grouped together is very important. Again, let me go back to your BMI, okay? When you're talking about your BMI, your decision or how can you now put on your knowledge in terms of your BMI, you always have to go back in terms of the formula. Okay, and that's why when you start defining your height in meters and weight in kilograms, okay, age in years, this would have to be a very important concept coming from your basic knowledge in nutrition, particularly your BMI. So where is your information standard coming from? From nutrition concepts. Okay, and this is something that you need to articulate if and when you're talking about your information knowledge management competency as part of your nursing informatics competency. Okay, next would be articulates the importance of standardized nursing data. Again, we go back to the first example that I have provided, like your BMI, because when you're able to articulate the importance of standardized nursing data, this will now tell us that the definitions, terminologies are clear. And if this is articulated or this is actually implemented or communicated, everyone else would be able to understand. When you say weight for the BMI, automatically it's in kilograms. When you're saying height for the BMI, it's automatically now you're saying that it is height in meters, not in feet and inches, not in centimeters. Okay, so that would be part of your information management competency. And then the last one would be critically evaluates data and information from a variety of sources to inform delivery of nursing care. Okay, so when you look on in terms of nursing, we know that there are certain sciences that are borrowed. Okay, we are starting to develop, we have just started way back in 1980 in terms of the nursing science. But we have been taught many things, but these things are coming from our borrowed science. Like when you talk about anatomy and physiology, this is from your medical sciences. When you talk about psychology, this is also a borrowed science. Okay, when you talk about public health, this is also a borrowed science. So therefore, one of the most important things that you're going to have to look into is that you need to evaluate data, critically evaluate data and information from a variety of sources to inform the delivery of nursing care. So again, when we group data together, we need to understand that there are many definitions of certain information or terminologies that we have. And that's why you need to look on which one really is that definition, which particular data and information would be necessary for us so that we would be able to provide appropriate nursing care. For example, again, I go back to my definition of your BMI. Now talking about the formula for BMI. Okay, where would your information come from? Because commonly, when you now talk about height, we're just measuring it in centimeters or in feet and inches. But when you're now putting it in the context of the data for BMI, which is now coming from the nutrition, okay, as your borrowed science, okay, then you have to know that your height specifically would have to be measured in terms of meters. Okay, so information and knowledge management is really very important because from data, you need now to group them. And for you to be able to do that, you need to be critical. You have to do your critical thinking. You have to analyze what particular data and where would this come from your knowledge. Okay, what has been taught you in terms of the other sciences. Okay, and that's why when I talk about this, you don't only need your ICT as a background, but you need all the previous major subjects in nursing, like your fundamentals of nursing science, fundamentals of nursing practice, your foundations of nursing science, your medical surgical nursing concepts, and all of the other concepts, or the major subjects that you have to have for you to be able to really understand the information and the knowledge that has to be managed in relation to your nursing informatics. Okay. The third component, no, particularly of your nursing informatics competency would be professional and regulatory accountability. Okay, so when you talk about professional and regulatory accountability, the competency particularly on complying with legal and regulatory requirements, ethical standards, and organizational policies and procedures would have to be part of the competency. Again, for you to be able to comply, you have to have the knowledge on what particular legal and regulatory requirements are there, for you to be able to comply. So in the Philippines, we have what we call your Data Privacy Act. In the United States, there's what you call your Health Information Portability and Accountability Act. There's also the Health Information Technology and Economic Compliance Healthcare Act. So again, I did not have time to really find out what are the legal and regulatory requirements, particularly in Indonesia. But I think we also have your Data Privacy Act. Okay, because now with the ICT that we have, as I've said, now one of the things that we need to look into is actually the protection of the patient's privacy and confidentiality. And we can only do that by identifying certain regulatory requirements, because these regulatory requirements would actually bring us about the guidelines on what is it, what are the requirements for us to be able to develop certain information systems for our clients. Okay, and then of course, we do not forget ethical standards. And since we have the legal and regulatory requirements, this would have to be aligned in terms of the organizational policies and procedures. Okay, so when you're working on in terms of a particular area or hospital, or it could actually be a clinic, okay, they should have organizational policies and procedures. In the Philippines, we also have what we call the joint memorandum or joint administrative order of our Department of Health, the Philippine Health Insurance Corporation, and the other institutions, including the Commission on Higher Education. Okay, so this is the Health Privacy Code. Okay, so we have certain things such as those for us to be able to assist us in terms of, trying to protect the security and the privacy of the clients. So we need to understand those for us to be able to comply. Okay, and that's why part of the input supposedly that you would have if you have your nursing informatics class are the legal considerations that you have in relation to nursing informatics. Okay. Second would be, since you're complying, you need to be advocating for the use of current and innovative ICT that supports safe and quality care. Again, you have to go back in terms of your knowledge in your basic ICT. Okay, which particular applications are there? Okay, what particular systems? Are there certain software that would have to be utilized so that we would be able to provide safe and quality care? Okay, take note, part of the safe and quality care would actually provision of security for the information that is in the system. Okay, and therefore we need to advocate for the use of the current and innovative ICT. Okay, for example, how well do you know the function of your core i5? How well do you know 8th Gen? Okay, what is it for? If you're looking on in terms of your cell phone, what is RAM4 or RAM4? Okay, so these are the things that you need to understand. And these are concepts coming from information science and computer science. Okay, so again, we cannot just rely basically on nursing concepts when we're talking about nursing informatics, because we have to be also knowledgeable in terms of these things, because we need to advocate for the use of the current and innovative ICT that supports safe and quality care. Okay, I think you are all part of the Gen Z. Okay, so which means that you are living in the internet, and therefore you cannot live without the internet. So therefore, you can actually search for information, and you would know what are the current and innovative ICT that can support safe and quality care. Third would be maintains effective nursing practice and patient safety during any period of system unavailability. Okay, with technology, the thing is that we sometimes forget that there has to be a backup. Okay, that in case technology or the system would crash, there will be no internet. What can we do? Okay, so we need to go back, in terms of what is it that we need to do. So there has to be a backup. Okay, we cannot be totally dependent on technology, and that if and when technology crashes, we no longer can work out. Okay, this is what we call business continuity. We need to continue in terms of the things that we're trying to do, even though without with the presence of the problems in technology. Okay, and this is what it means to maintain effective nursing practice and patient safety during any period of system unavailability. So what do we mean here? There has to be a physical backup. Okay, you have to determine minimum data sets or minimum data or information that has to be there for you to be able to provide effective nursing care and would be able to provide patient safety. Yes, all the documents are in the computer, but the question would be, just in case there's a brownout, just in case there's a system shutdown, what do we need to do? Okay, so therefore, one of the most important things that you're going to have to look into in terms of accountability is that you should have a physical backup of certain necessary information. I said minimum data sets, data that are important for you to be able to provide effective nursing practice and patient safety. Okay, if and when your system would crash. Okay, so risk assessment and risk management is also part of your accountability. Okay, the fourth one would now be demonstrate professional judgment, must prevail in the presence of technologies designed to support clinical care. So when we talk about professional judgment, again, you have to put in your knowledge in relation to your information science, computer science, and nursing science. Okay, what is it that you need to move into so that the technologies could actually have a supporting clinical care? Okay, when you now try to look on in terms of your DIKW as a framework, the transformation of your data to information, there is an automated system called information system. Okay, when you're just transforming data to information. But when you start in transforming information into knowledge, there is something what we call your decision support system. The automated system is your decision support system. Let me go back to your BMI as an example. Okay, data as it is gathered now when you look at it is actually your age, gender, weight, and height, and sometimes nationality. When you transform it, when you group them all together, you say the information is actually your BMI. Okay, BMI. When you transform it, your knowledge of BMI, when you start to transform it into knowledge, you're gonna say, okay, the score of the BMI could actually be, or could actually tell us if the person is normal, overweight, underweight, or obese. Okay, so the question would be, will you need to compute? The answer is no. Why? Because there are already systems that could actually automatically compute and inform you in terms of what is the BMI of the client, so that automatically you would know what would be the BMI. Okay? And I think once you use that system, okay, or once you use that application, it would be able to provide you a support for your clinical care, because you just have to input age, you just have to input weight, height, and then automatically it would compute for your BMI. And then from the number or from the output of your computation, you would be able to decide, or if sometimes you just already see, that this particular person is obese. Okay, so you don't need to compute anymore. You just have to look on in terms of input the data, and then automatically you are able to identify that the patient is obese. Then you can now have your clinical intervention or your management in terms of the patient situation. Okay, so that's the transformation of your data information to knowledge. Okay, and now when you come up with certain actions, okay, or interventions that you need to do, that is now what we call your wisdom. Okay, so recognizes the importance, the fifth one would be recognizes the importance of nurses' involvement in the design, selection, implementation, and evaluation of ICT applications and systems in healthcare. Okay, so when you now talk about this, it is always important, why are there not so many nursing information systems that really are that can be utilized by nurses? Okay, because we rarely find nurses really being involved in terms of the design and development of nursing information systems. Majority of the information systems that are utilized is actually on health and hospital. Okay, which means that we can only utilize it to a particular level. Do we have a system that wherein you can actually now put on the assessment and automatically there is a nursing diagnosis that could be identified, and automatically there could actually be interventions and outcomes that would have to be identified? Okay, I think I haven't seen one yet, no? But it could work. Why? Because there is already NANDA as a book. There is NIC and NOC. No? Therefore, these classification systems would actually help us supposedly. But we do not have anything such as such yet, no? Because the nurses' involvement is really not yet seen. And therefore, in terms of nursing informatics, you need, or we need to be involved in terms of the design, okay, the selection, the implementation, and evaluation of ICT applications and systems in healthcare. Okay, this is nothing new. No, this is not new, because when you look back in terms of the history of nursing informatics, we would see way back in 1970s, okay, where nurses are already involved in terms of designing of healthcare or hospital information systems. Only that, no, we have not really called it yet as nursing informatics as a practice or a specialty. So therefore, you need to really understand what is it that is there. And this is now where we integrate the knowledge in nursing science, nursing informatics, and even your computer science and cognitive science in terms of the applications and systems. We need to be involved in the design, selection, implementation, and evaluation. Why? Because nurses are the ones utilizing this. Okay? So this also tells us that when you talk about nursing informatics, you should have a background in terms of nursing practice. Okay, what do nurses do for you to be able to understand the workflow, the terminologies, the input, okay, for you to be able to understand the process and the outputs that are necessary for nurses in the field. Okay, and that's why when you design, it should be something coming from a need. Okay, a need that would support, supposedly, when you try to develop a system, it would actually now support the work of the nurse. Okay, to better come up with decisions regarding patient care. So that's why recognizing the importance of the involvement in the design, selection, implementation, and evaluation of ICT application and systems in healthcare is actually part of the accountability of the nurse informaticist, okay, or the nursing informatics practitioner, for you to be able to really recommend things in terms of the practice. Okay, and then I think this would be the last competency, the use of ICT in the delivery of patient care. Okay, so first would be identify and demonstrate appropriate use of a variety of information and communication technologies. So like, for example, when you now talk about it, we can bring the laptop or the iPad or the tablets in terms of your bedside care. Okay, so of course we need to know how this would be utilized, and if there are applications or systems of that can be used for patient care, we need to know. Okay, which means that the nurse informaticist, okay, would have to also train you before you can actually utilize this. Okay, so the training and orientation as regards the use of the system is also important for you to be able to appropriately use your ICT technologies. Second, uses decision support tools to assist clinical judgment. Okay, as I've said a while back, when you now try to look on in terms of the automated systems, where would you find it in terms of your DIKW framework? From the information to knowledge, okay? Again, from the computation of your BMI to identify if the patient is obese, underweight, overweight, or, normal. So if that could actually be automated, this could actually be your decision support tool, for you to be able to say automatically, just input the data, okay? And then you say, oops, the patient is obese. Now you could actually come up with certain information or intervention that could assist the patient, towards him. Okay. And what is the support tool, the decision support tool that you had? The application that is computing for the BMI. Okay. So you need to utilize those support tools for you to be able to be lesser time for computing. Okay. And then there would be more time providing for interventions in terms of your client. Okay. Next would be uses information and communication technologies in a manner that does not interfere with the nurse-patient relationship. Take note, it's not because there is technology that we will no longer have face-to-face interaction with the client. Okay. That's a no-no, okay? And that's why when you now talk about nursing informatics, we still don't abandon the basic, or the essence of nursing science, which is now caring for your patient. And when you say caring for your patient, okay, we only use technologies for us to be able to provide more appropriate care to the client. But we are not confined in terms of the technology. So which means that there would still have to be a face-to-face interaction with your patient, okay? And there has to be, and that is something else that we need to look into, okay? Though we use technology, it does not interfere with the nurse-patient relationship. Fourth would now be describe the various components of the health information systems. If we are utilizing the health information systems, we know the different components and what does it do. And what does it do? Why? Because if we will be utilizing it for the delivery of patient care, we need to know, okay, for us to be able to utilize it more appropriately. The sixth one would be describe various types of electronic records used across the continuum of care and their clinical and administrative uses. There are different electronic records that could be found, okay? Again, I think in the Philippines, I would say in the Philippines, one of the challenges that we have is that there's a lot of information systems, okay? Even with health information systems. We have one for surveillance, we have one for reporting, okay? So we have a lot. And when we describe this, we need to know what are their uses, where will you use it, okay? So if you have electronic record in the primary level, which is now your puskesmas, okay, how does it relate to the clinical and what are their uses? Okay, you have to look at that. Okay, why? Because there is a possibility that you'd be able to understand how your electronic record, or the information system that you have in the puskesmas or primary level could actually connect to your secondary and tertiary level of healthcare. So we need to describe the various types so that when you start utilizing it, you are able to utilize it appropriately. Okay? And then the last one is to describe the benefits of informatics to improve health systems and quality of interprofessional patient care. Okay? As I've said a while back, when we now try to look on in terms of first the rationale, why do we need to really utilize informatics? The first one would always be to support, to support your nurses, support patients, support other healthcare professionals, support your institutions, support the third parties in relation to improving the health systems, coming up with certain decisions so that there will be appropriate, safe care for your client. Okay, and this is the benefit of informatics now as we now try to improve the health system and quality of patient care. Okay, so this is the last competency that you're able to look into. So looking back in terms of the different competencies, you can now identify how competent are you, in terms of the different healthcare, different nursing informatics competencies that we were able to discuss. I've looked on in terms of some studies that would now tell us about factors that facilitate nursing informatics competency. Okay, and accordingly to Kesri and Abedokha in 2019, computer skills, okay, self-efficacy, your perception of how well would you be able to do, your evidence-based practice, and time spent on hospital information systems are determinant factors of nurses informatics competencies. So the recommendation provided by Kesri and Abdata is that developing nurses' basic computer skills incorporating informatics education programs into the curriculum can enhance nurses' informatics competency. Okay, so I'm not really sure how you are utilizing your basic computer skills, but I think now this would actually really enhance certain things. And I think this would be for the educators out there that you need to encourage nurses to utilize basic computer skills, okay, for them to be able to master, or facilitate the use of the nursing informatics competency. Or if not, you have to integrate your informatics education program. Another study is by Wang and Park in 2011, wherein they were able to see that significant factors associated with informatics competency were, again, basic computer skills and formal informatics education. Okay, so again, understanding where you're coming from, as I've said, true, the basic computer skill is actually part of the prerequisite of your nursing informatics, but the two courses are really very important for us to be able to utilize for us to be able to learn nursing informatics competencies. Okay, so accordingly, the study findings suggest that the enhancement of basic computer skills and incorporation of informatics into formal nursing curricula are needed to improve the nurses' competency in managing and using healthcare information. Okay, so that's from the study of Wang and Park in 2011. And I think this is the last study according to Clave and Nagel in 2018. So overall, informatics competency means scores varied in relation to age. Okay, so there is significant difference when it comes to age. And I think I would say the younger you are, the better your competency, because you're more familiar with the computers. Educational qualification, the higher your educational qualification would be, the better supposedly you are in terms of, because if you have attended trainings or there's a formal training for nursing informatics, then you know that there would be a better informatics competency. Then, of course, years of experience. Okay, so if you recall the first research that we're able to see, that when you now are utilizing your health information system or your nursing information systems, then there is a better competency that you'll be able to see. And of course, work setting, work environment that is technology enabled would actually help us out in terms of learning our nursing informatics competency. Okay, so that's why the recommendation provided by Clave and Nagel is that findings from this study would now provide a basis for actionable policies to address informatics educational needs and support requirements among nurses practicing now and in the future. Okay, so if we're going to learn nursing informatics competencies, we really have to learn things accordingly. And the environment and the school where we are should be able to provide the support that we need in terms of learning nursing informatics competencies. So let's now move on towards the synthesis. Looking on in terms of nursing informatics, you know that education is very important, and evidence-based practice says, or evidence says in researches would now say that education or providing formal education in nursing informatics would actually improve really the nursing informatics competencies of the nurses. Okay, next would be informatics nurses are bilingual. They can talk IT and can talk nursing. As I've told you a while back, when you now look on in terms of definition of nursing informatics, it is the integration of nursing science with information science, computer science, and cognitive science. So you cannot do informatics or nursing informatics without understanding or knowing certain languages, or nursing and certain information, certain terminologies that are being utilized in IT. Okay, so that's why we need to be bilingual. In informatics, according to Joyce Semenayer, informatics nurses have unique opportunities to inspire others through our work to streamline documentation, optimize workflow, build the foundation of evidence, and create a data-driven culture. Okay, so for us to be able to work on nursing informatics, we need to become bridges. Okay, we need to bridge the nurses in the area and the IT people so that there will be a system that will assist nurses in terms of their difficulties. So the question of, are informatics nurses in the front line? Are they in the area? The answer is no. But you have a knowledge. You should have a knowledge of what is happening in the front line or in the area for you to be able to bridge the information and provide the information to the IT specialists and come up with systems that would be able to support nurses. Okay? And that's why, according to Ruth Scheller, the Chief Nursing Informatics Officer of Legacy Health, she said, my role is to connect the dots between compassionate care and innovative technologies. So, are we ready for nursing informatics? And are we ready for a technology-laden world? Okay, I think that would be all. Terima kasih and good day, everyone. I think we're now ready for certain questions. Are there?
I'm Lorica. Now we are going to the Q&A session. Please, for the students who want to ask to Ma'am Lorica, please raise your hand. Or for the audience in the Zoom meeting who want to ask directly, please click the raise hand button. Or you can drop your question in the chat box. Okay. Okay, we have a questions. Okay, don't forget to mention your name and then your question is, okay?
Good morning, Dr. Lorica.
Morning.
Please allow me to introduce myself. My name is Keisha Alisa Stefano from Class 1B, and I am a nursing student in Blitar Nursing Study Program. I have a question regarding nursing informatics, and I was hoping you could help clarify it for me.
Okay.
My question is there a correlation between nursing informatics and patient's independence? If so, could you please explain it further and provide an example?
Is there a relation between nursing informatics and patient's independence?
Yes.
Okay, yeah. Okay, thank you.
Maybe that's all for me. I apologize for any mistakes in my words, and thank you very much for your time.
No, don't apologize. Thank you for your question. Actually, when you now talk about nursing informatics, there is, okay, when I teach nursing informatics, there is a particular concept that talks about application of nursing informatics to nursing practice. Okay. And when you talk about nursing informatics, one of the things that you're going to have to understand is there is such thing as personal informatics. And when you talk about personal informatics, you can actually look on in terms of how would you be able to connect patients in terms of your care. Okay, we can actually facilitate patients' independence when you talk about certain ICT technologies that are currently being utilized. Example, do you have a smartwatch? Do you have an iPhone? iPhone or any smartwatch, smartwatch and smartphones have a health characteristic, right? They have a health application. Okay, I'm utilizing the example of a smartwatch because with your smartwatch, there are certain things that you can actually look there, right? Your activity, your heart rate, now even with blood pressure, and even with your blood sugar, there is now a watch that would monitor your blood sugar. So if you're utilizing your smartwatch, in terms of that, you can actually coordinate. If you are the patient, if you are the nurse, you need to teach your patient in terms of utilizing that particular application so that she or becomes independent in terms of monitoring her own health and then coordinate that in terms of your client. Okay, so if I am looking in terms of the smartwatch, I can teach the patient to monitor her own blood pressure through her smartwatch or even the smartphone. Okay, if you're encouraging people to do activities, there are also monitoring for the number of steps, and that number of steps can actually be also configured or translated into number of calories lost. So if you are into informatics, okay, you can actually teach your client to become more independent in terms of monitoring their own health. And if and when they have problems like increased blood pressure, they can tell you, because they can now personally monitor. You don't need to be the one monitoring the blood pressure of your patient. You don't need to be the one monitoring the blood sugar of your patient because they can do that. And then they can just provide feedback to you. And in that way, I think informatics, could actually help you out, help out the nurses in terms of making the patients become more independent in terms of their health. Okay, I hope I answered your question. Thank you.
Thank you, Ma'am Lorica. Is there any more questions from the audience? Keisha, is that enough? Thank you. And then is there any more questions from the audience here?
I think there's a question on the...
Yes. Oh, yeah.
chat.
We have a questions from the chat box from Ma'am Dewi Rahmawati. I'll read the questions. I want to ask how the implementations of ICT in hospital in the Philippines and what digital competencies should nurses possess to succeed in the area of nursing informatics? Please, ma'am.
Okay, so I think in the Philippines, we only have, I think, hospital information systems. Okay, in terms of nursing informatics, there are certain things that we need to look into yet. As I've said, nursing information systems are not yet working well in the Philippines. Okay, so the most common that we see is hospital information systems. And of course, in the Philippines, there are many health information systems that we are utilizing. One of the issues that we have, that's why we have what we call the Department of Information Communication Technologies, but it's a new department, and DOH has been working on in terms of supposedly a better health information system. Okay, but the problem would always be interoperability. When I talk about interoperability, there are different systems, but they cannot be connected to each other. Okay, they cannot be connected to each other. Why? Because it's different people develop the different systems. And therefore, when you now talk about the health information system, there are many. Okay, when they develop it, they made use of different natural language processing. They made use of different applications, and that's why we cannot put it together. If and when the Philippines would really like to come up with a better or an integrated, interoperable, connected health information system, we need to scrap out all of those and develop something that would utilize the same natural language processing, the same applications, or the same requirements that would have to be there so that when we start to put them together, they could be put together. Okay. Second question, you're asking about what particular competencies. I just mentioned, as I've said, there are many tools that would talk about competencies of nurses, okay, in nursing informatics. And I've just talked about certain aspects, I think there are 4 components and aspects of nursing competencies, which we could actually have or see so that we would be able to work on in terms of nursing informatics. If you're gonna ask me, I would say I am not yet very competent in terms of all of those, okay? But since I was trained, I know that, the concepts and trying to identify certain things in terms of what are the problems. And more or less, because I am very interested in nursing informatics, I am now more familiar in terms of the terms that are utilized in the IT, So I also sit now as a panel and work closely with IT professionals so that there will be certain systems that could actually be utilized in the Philippines. For example, in St. Paul University, when I have my nursing informatics subjects and they have laboratory, but in the laboratory they just design and conceptualize nursing informatics project. Okay, so what happens is that I usually turn it over to IT professors who have what they call the research of their students. Okay, they call it capstone. Okay, the students would identify a need and then develop a system. Okay, So I was able to work on in terms of two groups already. One was trying to develop the health services system, okay, of St. Paul University, and there is another group who was working on in terms of the requisition, nursing laboratory inventory and requisition system. Of course, that is just in the level of data, transforming it into information. But I think basically the ideas came from nurses, and at least we're saying that since the idea came from nurses, that is an important step towards providing for um, bridging the gap between nursing informatics on the practitioners and the IT, so that we will have a system that is workable for a nurse. Okay, so I hope no that I was able to answer the question.
Thank you, Ma'am Lorica. For Ma'am Dewi Rahmawati, is that clearly enough, or is there any more feedback or questions?
Okay, Miss, clearly, very clearly.
Yeah, thank you, Ma'am Dewi Rahmawati. So we have one more questions from Mr. Agus Koirul Anam.
Okay, thank you very much, Ms. Irka. And then thank you very much for Ms. Josephine. This is, I am Agus, lecturer in nursing study program in Blitar. So I want to asking about nursing information, and before we discuss about it, nursing information is very important exactly in the hospital. And I know to improving quality of services in hospital. And then sometimes our children get difficulties to give information because this is depend on interprofessional collaboration with a doctor, with a dietary, and then etc. So how to maintain and then to make interprofessional communication before we give information to our patient to prevent misunderstanding between nursing and patient. Maybe you can explore it when your children attached in the hospital. Thank you very much.
Okay, thank you for the question. I think yes, when you now are utilizing a health information system, it would be difficult now. But I think one of the best things that we have in the Philippines is that in the nursing curriculum, okay, in the nursing curriculum, we have what we call your interprofessional collaboration as a course. Okay, we have interprofessional collaboration as a course, and I think we started also in terms of working with the other courses in St. Paul University, particularly, in the School of Nursing and Allied Health Sciences. We have courses like pharmacy, medical technologies, physical therapists, and then we also have your radiologic technology. Okay, so they group them together because I think for those courses that have the same, the program coordinators agreed that they will be offered on the same semester, so that this particular group will be grouped with nursing students and they would be able to understand. Okay, so they all go through the same course, but with others. Now, of course, there are more nursing students in the class than the other courses, but they are all together so that they would be able to expound on and explain really what are the different roles. Okay, and in that way, they are also able to identify what would be the common areas that they have, as well as the specific areas that is well now on the different disciplines in terms of what it is. And I think that facilitates things. And then, of course, the nurse is always there with the patient. And it is always important that the patient or the nurse would also know how to communicate appropriately. Okay, and if and when you're talking about the hospital and the nurses are there, policies and guidelines are very important. Okay, policies and guidelines are very important. So I think that would actually facilitate a better communication. And if and when we're utilizing nursing informatics, it's automatic. It is there supposedly, depending on what particular system is there. Okay, of course, now in the Philippines, I would always say that we are just still in the IS, information systems. there are certain things wherein we're trying to move on towards decision support system. Okay, because with decision support system, there is already certain things no, that could actually be decided upon, and communications could actually already be provided depending on, for example, if and when a patient becomes problematic, okay, if they are hooked on the monitors, okay, and then there is a problem in terms of hypertension, if the doctors and nurses are connected to the system, the nurses are already notified through the computers or the cell phones if they're connected to the system. As the nurses are being notified, the doctors could also already be notified already. Okay, and that's why I was saying that one of the benefits or one of the importance of nursing informatics is that improved interprofessional collaboration. Okay, because the nurse will no longer just dial the phone and call the doctor. Okay, if there is really an important system such as that, no decision support, then the system would automatically inform already certain groups of people. So that would now facilitate intervention. Okay, so if the doctor is beeped and informed about the patient case, then he could already immediately go to the area if he is around the area, or communicate whatever interventions that needs to be done for the patient. Okay.
Thank you, Miss. Maybe suggest for the nursing study program must have interprofessional education, and then maybe for the lecturer, Mr. Ulum, we must have nursing information laboratory before deliver the student to the hospital. Okay, thank you very much, Miss Josephine.
Thank you.
Thank you, Mr. Agus, for the question. Thank you, Ma'am Lorica, for the explanations. And for the next questions, please raise your hand for the students here. Is there any more questions? Okay, please come forward. Don't forget to mention your name and then your questions.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good morning, ma'am. I am Fatima Sabila Azara. I would like to ask a question. How can nursing informatics improve patient care in a practical setting, especially for nurses who may not be very familiar with technology? That's all for my question. Thank you very much.
That's a difficult question. Because when you talk about nursing informatics, you have to be well versed with technology. Okay, but when you talk about, I think we need to maximize. I think that would be it now. Maximize the hospital information system so that we would be able to work things out. Okay, and I think we go the traditional way. If we talk about it, we go the traditional way. We use the cell phones. We use the smartphones, in terms of coordinating care to clients and to doctors. I think that's just it, if we're going. I think the hospital information systems now are able to connect the different areas of the hospital. So like, for example, the nurse will no longer have to go down, okay, will no longer have to go down to the laboratory for him or her to be able to get the laboratory results. The hospital information system has already it, so she can just log in. Okay, the only thing is that it does not have decision support, or there's no information yet that informs the nurse that the result is already in. Okay, so I think, yeah, we can still utilize it basically, but if you are not really into in technology, it will be difficult for the nurse to utilize nursing informatics. So that's why the basic, as I've said, requirement is that before you take on your nurse informatics class, you should have your ICT in the, not just computer course, but ICT in the 21st century, because you have to know what are the current information communication technologies in the 21st century for you to be able to integrate it in terms of your nursing informatics. Okay, but if the nurse is not really interested in terms of technology, I think nursing informatics will be difficult to be implemented. Okay, but I think we can still go the traditional way if we don't have still the systems. Okay, thank you. I hope I answered your question.
Thank you, Fatima, for the questions. Thank you, Ma'am Lorica, for the explanations. Is there any more questions? The participant in the Zoom meeting or the audience here for the students? Please, if you have more questions, raise your hand, or for the participants in the Zoom meeting, please click the raise hand button. There's no more questions. Ma'am Lorica, I have a questions. Actually, is it
Yes.
okay?
Okay.
Ma'am, so far in the Philippines, especially, what are the challenges for nurses when implementing healthcare technology or ICT in nursing practice? Thank you.
When we talk about the community, I think standardization of the terminology is still problematic. As I've said, when you go to the community, when you go to the Department of Health, and we have what we call the rural health units, there are many information systems that they're utilizing. So the integration is a challenge actually, because people at the ground are complaining. They were utilizing so many. So I think that is it. The interoperability is one of the challenges that we have. For nurses, I think would be the acceptance in regards to the use of technology. Many students, in fact, now when you now try to look at it, has a positive attitude towards the use of technology. Only that the challenge is that in terms, there was a mention in terms of laboratory, but what is in our laboratory? It's only computers. Okay, we don't have yet actual systems that we could utilize. Okay, so it is upon the faculty to become creative in terms of trying to find ways so that the experiences of the student would be able to, be able to work it out so that there will be a better understanding and learning of the competencies of the students. So the challenge for me, as a faculty of nursing informatics is that I have to be very creative so that I would be able to develop the competencies of the student. Okay. Second challenge would be the presence of the laboratory, okay? Because as of now, we only have the computers. We don't have yet certain applications or systems. But as I've said, I am now partnering with IT professors as part of the laboratory. I'm hoping that we would be able to come up with systems that could be utilized by the students, okay? As a faculty also, nobody wants to teach nursing informatics. They said it's difficult. So I've been trained for 5 years. I am now 33 years, 32 years in St. Paul University. I am retired, but I am rehired just in case, I will be, I would decide not to teach anymore. There will be a challenge for St. Paul University, particularly the College of Nursing, because I do not have a second liner. They don't want to teach because, again, as I've said, you have to be bilingual. You have to be interested, not just interested in terms of the ICT, but you have to learn the languages of ICT. Okay, because there are differences. For example, when you talk about module, okay, so the module that we know is the module for teaching, right? But when you talk about module in ICT, it's a different thing. So that's also a challenge. Training people to be able to teach nurse informatics. I think there is a regular training provided by the UP, okay, College of Nursing, for teaching nursing informatics, but so far in St. Paul University, I'm the only one that is trained. So I need to train. I need to convince more people to teach nursing informatics. Okay, I hope I answered your question.
Thank you very much, Ma'am Lorica. Okay, is there any more questions from the audience here? Or the audience from the Zoom? Okay, we have one more questions. Please don't forget to say your name and then your questions.
Okay, good morning, ma'am.
Morning.
Let me introduce myself. I am Apriliana Karen from class 1B. 1B. I can ask a question. What steps should be taken to address the digital divide and ensure equitable access to healthcare technologies in nursing practice?
Slowly, please. What steps can be provided for the digital divide?
Yes.
Right?
and ensure equitable access to healthcare technologies in nursing practice.
And enable equitable access to healthcare technologies. Okay. Yeah, that's quite an interesting question. Okay. Actually, I think Philippines is smaller, okay, and Indonesia is bigger. But in terms of areas, yes, there are certain areas of digital divide. Okay, so I think the concept of digital divide would actually say, even in healthcare, there is a divide because people would always come on the urban area where healthcare is many. Okay, while in the rural areas, there's only a handful. Okay, what steps? I think government would have to do about something about it. In the Philippines, we have what we call the DICT. Okay, so the DICT, or the Department of Information Communication Technologies, is now doing things so that there will be certain connectivity within the country. Okay, because the connectivity, I think everyone else has a cell phone, smartphone, but the problem would be connectivity because Philippines is an archipelago. We're separated by islands, and then of course we have mountains. Okay, and that's why there are certain areas where there's no connection, okay, or poor connection. So I think the government would really have to do something about connectivity, and maybe trying to put on certain things. In the Philippines, if I may also say, there was this particular device, we call it RX box, that was developed by the scientists, funded by the Department of Science and Technology. What does the RX box do? The RX box is actually a gadget that would collect your blood pressure, your heart rate, etc., for monitoring already. And this already is equipped with a connection, but it's still a cellular connection. So which means that this now RX box is brought to the different areas where there's difficulty in terms of reaching people. Okay, so the priority areas were given to what we call the GIDA, or the geographically identified, geographically isolated and disadvantaged areas. So they gave them the RX box so that they can utilize that to communicate to certain doctors in the urban area, okay, for cases that they do not have any problem. So I may not be able to describe it more appropriately, but they gave that. The government has to act on certain things as regards the digital divide. Okay, so I think connectivity is really a problem. Cell phone, smartphones, there's no problem because everyone already can afford it. Okay, there's a low end and there's a high end, but the connectivity would have to be done by the government. Okay, so I think the government would really have to do in terms, or would have to have an action in terms of the digital divide. So what can we do as nurses? Maybe we can, rally. We can, when I say rally, we can go to people and try to negotiate things and try to tell, or maybe we go to the politicians and say, can you come up with a law that would now provide the connectivity across the country? Yeah, so we become advocates. I think that's the basic thing that we could actually do as nurses. Okay, I hope I answered your question.
Is that clear enough? Okay. Okay, thank you, Ma'am Lorica, for the explanations. Is there any more questions from the students? Please raise your hand. Okay. So we have one more questions, ma'am. They're so enthusiastic about your materials. Please.
No problem. I'm quite happy that they're asking questions, which means they listen.
Yes, ma'am. Okay, before delivering your question, please, your name.
Okay, good morning, ma'am.
Morning.
My name is Santi Johanna, and I would like to ask, how can we ensure that nursing informatics solution priorities patient safety and confidently in an era of increasing cyber threats?
Again, how can we ensure that nursing informatics
solution priorities patient safety and confidently in an era of increasing cyber threats?
Yeah, solutions. Nursing informatics would ensure patient safety. Okay.
Yes.
Yeah, I think, well, that's the role of the nurse informaticist. No, you need to know how to, like when we talk about it, one of the things that you're gonna have to look into is that when you transform data, the first things would always be there has to be a clear data definition. Okay, standardizing the data would make people utilizing whatever it is, would have the same understanding. Okay, so therefore, when before you actually put in or develop a particular system, there has to be standardized data. And that standardized data, you have to make sure that it's the same understanding across all those people who will be utilizing it before you can actually transform. Okay, and that is the role of the nurse informaticist. Okay, you need to really make sure of that. And that, of course, before utilizing certain systems, you need to train people, educate them in terms of its use, so that there will be no problem. Okay, so I think basically that's how you ensure the patient safety. Okay, and then of course I think if you move on to a higher level, you need to look on in terms of an information system, or the nursing information system would have to have a particular capability to gather data and identify best practices. And I think with the best practices, you'd be able to identify, which best intervention could actually be facilitated, so that there will be a better outcomes for your patient. Okay?
Okay, thank you, ma'am.
You're welcome. I hope I answered your question.
Thank you, Santi, for the question. Thank you, Ma'am Lorica, for the explanations. Is there any more questions? We still have time for the students. Please raise your hand if you have any more questions. Dear committee, is there any more questions? No? Okay. Thank you, Ma'am Lorica. We have many questions this morning. They are so enthusiastic about your material this morning. Okay, I will wrap up this material in summary. As we know, nursing informatics is very essential for transforming healthcare system by improving the quality of care, reducing costs, and ensuring patient safety. It is a key enabler of the ongoing shift toward more efficient, data-driven healthcare. Ma'am Lorica, for after this Q&A session, we have certificates as our gratitude for you as the speaker this morning. Please, for the committee, the certificate, please share the screen. Please, Ma'am Wiwin.
Oh, no problem. Maybe you can show the certificate to Dr. Lorica. Thank you, Dr. Lorica. Maybe student have
There's
to
already the
know.
certificate.
Yes, maybe student have to know if Dr. Lorica is my teacher when I studied at St. Paul University, Philippines. Thank you
Wow,
very much.
that was amazing, ma'am.
Yes, yes. The good teacher, very
Yes.
good.
Thank you.
Thank you, Ma'am Lorica.
Yes, I think enough. Hopefully we can visit again to your institution, Ma'am Lorica.
Yes, come visit so that you bring students.
Yes,
So they
maybe
can see St.
exchange the
Paul.
student like
Yeah,
that.
or even faculty.
Yes. Already visit and exchange the lecture at Visayas State University, ma'am.
Oh,
Yes, before Mrs. Ika, I think already went to your institution.
mhm.
Right. Yeah. Maybe you can fill the link presents, ma'am. I think enough, Ma'am Ika. Yes.
Thank you, Ma'am
Thank you
Wiwin.
very much.
Thank you, Ma'am Wiwin. Okay, Ma'am Lorica, we hope in the future we can meet in person in Indonesia, ya Ma'am Lorica. And then Ma'am Lorica can share again about more materials and another materials in Indonesia offline. Hello, Ma'am Lorica.
Yes, yes.
Okay, yes. Thank you very much for the spectacular and amazing materials for this morning. And all the students were really enthusiastic about these materials. And then as the moderator, I'm so sorry if I have some mistakes, and back to the Master of Ceremony.
I say thank you very much for sharing with us as the speaker today. It was an extraordinary material. And also, thank you very much our moderator, Ms. Irka Maharani. Well, that's wrap up our event today. To close the event, we invite Silva Prameswari to lead the prayer. Time is yours.
Thank you, Amel. Assalamualaikum warahmatullahi wabarakatuh. Peace be upon us all. Shalom, Om Swastiastu, Namo Buddhaya, greeting of virtue. For Muslim, I will lead the prayer. For non-Muslim, please adjust. A'udzu billahi minasyaitonir rajim. Bismillahirrahmanirrahim. Allahumma salli ala sayyidina Muhammad wa ala alihi sayyidina Muhammad walhamdulillahi rabbil alamin. Ya Allah, by giving thanks for all your grace and blessing today in good health and happiness, may you give your blessing and blessing at the international guest lecture, even with the theme Nursing Informatics for student of the Diplomatry Nursing Study Program in Blitar. Ya Allah, the most gracious and merciful, this guest lecture even mean a lot to us, making us a generation of faith and piety, a generation of quality, so that we can achieve the ideal of this nation and state. For this reason, Ya Allah, instill in us the quality of your soul and spirit, so that we can gain useful knowledge and give us confidence in every step we take. Ya Allah, the most forgiving, forgive our sins, the sins of our parent, as well as the sins of our leader. Give us guidance and awareness so that we always walk on the path that you approve of. Guide us to the right path and keep us away from all disaster, mistake, and suffering. Rabbana dalamna anfusana wa ilam takfir lana wa tarhamna lanakunana minal khasirin. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you for Silva Prameswari. Before we finish our activity, there will be a documentation session by documentation team. So for all of the participants, please turn on your camera. So documentation team, time is yours. Okay, I will lead for this session and I want to count down in 3, 2, 1. One more time. 3, 2, 1. Okay, thank you for the documentation team. Ladies and gentlemen, finally, we have through all the event today. So, I as the MC, personally, I would like to say I'm so sorry if there are mistakes in my utterance during handling all program or session in this program. And also, I say thank you very much for your participation in this program. Now, we close this activity with recite Hamdalah. Alhamdulillahi Rabbil Alamin. Ladies and gentlemen, now all the program has been ended. So, I as MC today, I do apologize for any mistake. See you and wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Kak Bel.
Oke, terima kasih semua ya. Jangan lupa mengisi daftar hadir ya. Dan evaluasi. Oke, terima kasih.